Pressure ulcers by Patrick Batista. Pressure ulcers, also known as bed sores, are sores on the skin which result from prolonged pressure on the skin. These types of ulcers usually occur around bony areas of the skin, so this can occur anywhere on the body, including the heels, ankles, hips, and tailbone. These types of sores are typically seen in bedridden or seriously ill patients. And a pressure ulcer can appear for many sorts of reasons, but with proper preventative measures and education for nurses, I believe that the percentage of ulcers can be minimized in hospitals. There are more than 200,000 cases per year, and when pressure ulcers elevate to cases above a certain stage, they can be difficult to treat. Why pressure ulcers are bad? Ulcers come in 4 different stages, and when caught in the early stages, it is much easier to treat through various procedures. As I said before, when a pressure ulcer hits stage 3 to 4, it can become a lot more difficult to treat because infections become more likely and they can actually become fatal. And at these stages, muscles, bones, and tendons may also be visible. So the stages... Stage 1, the skin will look red and feel warm to the touch. It may be a little itchy. Stage 2, there could be a painful open sore, a blister with discolored skin around it. And when you get into stage 3 and 4, it really starts to become evident that something is wrong, because in stage 3, a crater-like appearance develops due to tissue damage below the skin surface. And in stage 4, severe damage to skin and tissue can result possibly with an infection, and muscle, bones, and tendons are also almost visible. So in this picture you can see stage 1, stage 2, stage 3, and stage 4, where all of these are visible, including the bone. This is where infections are the most likely. So there are 3 main causes to how ulcers begin. The first one being pressure. A pressure ulcer occurs due to pressure caused by a load of force being exerted on an area of the body. For example, this could be a patient's body weight pressuring their hip or tailbone. This causes a decrease in blood supply to that area and pushing everything between the skin and the bone to the surface. So this is what causes a pressure ulcer. Bedridden elderly people are most at risk for these types of ulcers as they cannot move. Shearing is the second type that causes an ulcer. This is where there is pushing or pulling against the skin. This means that more than one layer of skin slides against each other, and this can cause damage and an ulcer can begin to form. Although it may be hard to tell because these types of ulcers can be formed below the skin until breaching. And lastly, so here in this diagram, you can tell by the shearing of the pushing and the pulling force is what creates the pressure. And lastly, friction. The last form of pressure ulcer occurs due to friction. This is where 2 surfaces rub together. This could be friction between anything really, skin in a bed, a blanket, sheet, cushion, pillow, clothing, really anything. And one of the big things that doctors and nurses like to avoid is moist and hot skin for their patients, because this is the most likely to experience the most damage from friction. And here you can see, obviously, tight bedding and the pressure creating friction on the tailbone, heel bone. So the most prominent areas, as I've said before, the tailbone, heels, hip bone, elbow, knee, wrist, ankle, mainly all the joints and places that patients are usually resting on. So there's a lot of preventative measures that can be taken that can avoid pressure ulcers, but they're not actually regulated. They're not actual regulations or rules in a hospital. So due to the fact that pressure ulcers are an abrasion of the skin, there are a lot of steps that can be used to prevent ulcers in hospitals for patients that are more likely to receive these types of ulcers. So obviously bedridden and seriously ill patients. When these patients bathe or bathe themselves, it is important that they use a soft sponge or a soft cloth, as this can really minimize it. The skin is sensitive, and if a rough cloth or sponge is used, it can irritate the skin and make them more susceptible to an abrasion. It is also important what type of soap is used. It's suggested that a patient should not use strong or skin-drying soaps, as this will also make the skin very irritable. Patients should avoid bathing every day, as this can dry out and also irritate skin. And it's also very important that after bathing, patients clean themselves entirely in dry areas under their armpits, behind their knees, their groin, and breasts. Patients can apply moisturizing cream and skin protectants daily. Lastly, it is very important that patients or nurses check themselves every day for ulcers to make sure that their skin is clear. Early detection of pressure ulcers can make a huge difference in their treatment and prevention of infection and furtherance. So I've drawn up, there are some care plans. There are care plans in place that provide additional assistance and prevention to pressure ulcers. One of the most important care plans that should be in place at every hospital and should be taught to all nurses is as follows. As you can see here, all caregivers should have access to body maps for their patients so they can record, where there is skin damage, and they should use these body maps and charts to record on a daily basis that every area has been evaluated and checked if there is a pressure ulcer. After checking and grading all the pressure ulcers, whether they're stage 1 to 4 or, the lack thereof of them, should be submitted to review. A patient who has been evaluated and has pressure ulcers and who is unable to reposition themselves in bed should be repositioned every 2 hours to prevent ulcers from progressing. A caregiver should record whenever a repositioning occurs and what position that patient has been moved to. This minimizes friction and shearing damage and can seriously impact the decreasing in percentage of pressure ulcers in hospitals. If a hospital has the funding and has the equipment to provide pressure reducing mattresses, it is imperative that they do so. Pressure relieving mattresses are designed to completely remove all pressure This takes a lot of work off a nurse's shoulders, as they no longer have to reposition a patient who cannot reposition themselves every 2 hours. And after they do this, they should record what they've done, obviously with the body maps and the charts, and it makes a much more comfortable stay and stress-free environment for both the patient and the nurse. So another really big part of avoiding pressure ulcers is having their patients eat a well-balanced diet, and it actually goes a long way, because what you put in your body, it directly affects your skin and your skin strength. So when you're maintaining nutrition, I believe the most important thing is you need to drink plenty of liquids. You have to have plenty of water in you, whether it's water, Gatorade, Pedialyte, really any liquid that you can get inside your body, besides, pressurized things like soda and sugary drinks. It's really going to help strengthen your skin. And on top of that, if you eat a healthy, balanced diet of meat and fish, fruits, veggies, bread, potatoes, cereals, when you're from your dairy products, you're getting cheese and milk. And if these are really spread out and, you're getting healthy carbohydrates from, whole grain breads, sweet potatoes, healthy cereals like Raisin Bran or Chex Mix, and you're getting, your carbs also from your veggies and sugars from fruits, and basically everything that's whole and where it's coming from. It really helps strengthen the skin and prevents ulcers from even having the opportunity to break through the skin or even start below. So when it comes to funding, funds are relatively short. There are 32 grants involving funding for pressure ulcers. A majority of these fundings come from government entities. So the funds come from the National Institute of Health, the Department of Veteran Affairs, the National Institute of Disability and Rehabilitation Center and the Agency for Healthcare Research and Quality. The funds make up just about above $16 million, and the investment in pressure ulcer research is minute compared to others. Policymakers have been encouraged to increase federal funding for research concerning pressure ulcers. If policymakers were able to provide more funding to pressure ulcers, a lot of the equipment needed to prevent these types of skin abrasion could be provided. The equipment is everything that I've said already, including proper soap, proper cloths and sponges, the pressure relieving mattresses, and more. And with more funding, a high percentage of pressure ulcers could be diminished. So, as for regulations, all stage 3 and 4 pressure ulcers are to be reported as serious incidents requiring investigation. So this helps with a further understanding of pressure ulcers and why and how they develop to that stage. And it also contributes to what we can do from that stage as to how to heal them and what we can do from that point on. So quality management or quality improvement of this is basically critically ill and bedridden patients are at an increased risk for pressure ulcers. So inform nurses who are aware of what to look for when it comes to pressure ulcers, and taking the preventative measures that have been drawn up, it would decrease the overall percentage of pressure ulcers in hospitals. And a way that this could be done would be to have one-on-one construction with bedside nurses so that they can understand the measures for ulcers and be on the lookout for them, and knowing and understanding all the alternatives, and just knowing, what they can do in that moment that's going to, help their patient out. Also, their knowledge on the type of the wound as to why is it occurring, and having the ability to move forward to heal the wound, whether it's pressure, whether it's shearing, or whether it's friction. And then they can report it and make sure that the same thing is not happening to other patients and take the correct preventative measures with them. So this type of quality improvement has been issued in a number of hospitals, and these hospitals have seen a decrease in the presence of pressure ulcers in bedridden and seriously ill patients. I believe this trend will continue with proper education and reporting of all ulcers, because the more that nurses know and the more that caregivers know what to do in these situations, what to look out for, what equipment is best used, and how to, educate their patient on what they should be doing, including, their routine, checking themselves daily for ulcers, avoiding bathing daily, and when they do bathe, using the correct things and whether or not they're getting bathed. I think it's really important. It makes a really big difference, because the more people are informed about these things, the less likely they are to occur. So here are my references. So basically, in conclusion, to sum everything up, so pressure ulcers are known as bed sores, and they're sores on the skin. And they usually occur around the bony areas of the skin, such as the heels and the ankles, the hips and tailbone. And the heels and the tailbone are the most prevalent when it comes to these type of sores. They're mostly seen in bedridden or seriously ill patients, who can't get out of bed. And an ulcer can appear for many sort of reasons, but I believe with proper preventative measures and education for nurses and patients, the percentage of ulcers can be minimized in hospitals. Quality management can help decrease the number of ulcers caused per year if the proper measures are taken. Increased funding can provide the equipment needed to eradicate all cases that arise and prevent cases from reaching stage 3 or stage 4, where it becomes really expensive and infections become likely, and fatality is possible. Proper education would teach caregivers to understand all sorts of pressure ulcers, when they're a threat, what to do, how to prevent and cure all that arise. With these quality management improvements to the healthcare field, specifically patients who are seriously ill or at high risk, I believe the number of cases can be drastically changed from 200,000 to hopefully half that with these preventative measures. Thank you.